yesterday I received an email, or a text rather, and the text was came from a good friend of mine up in Pleasants County. His name's Jay, and I'm not going to go into his last name, but Jay had a real concern about the metric that we were using as it reflected to the smaller counties. Now that's all he said, but that's all somebody's got to say to me, and I'm going to go back and double check it. So I went back and we started through the math, and we called everybody together yesterday evening, and we started checking, and lo and behold, we do have a bias. Even though we're moving it and adjusting it with population, it does show a skew or a little level of bias. And so it was a good tip. And we went right back. We went right through the math. Dr. Marshall will explain that to you a little bit better, but Superintendent Burch will answer the first part of the question.
Sure, and I'll also ask Dr. Marsh if he wants to chime in. We've been having a conversation. So for 3 months, the plan's been being put together. Prior to us having the Kellers, we talked about mask wearing on buses, non-congregate areas. We talked about masks when they could not social distance, especially we were concerned with our grades 6 through 12. And so, yes, now that you see the color coding map, we're going to actually revisit that and have a discussion. We've asked DHHR and Dr. Marsh to have a discussion with us about what that could mean to as part of a mitigation as you increase colors. And there may, we absolutely will be looking at additional requirements for mask wearing.
And I would just say very briefly, because we have not finalized this meeting, that we are very committed to adhering to the highest standards, CDC guidelines and others, that make recommendations to make the classrooms as safe as possible for all involved. So more to follow on that. When it comes to the reason why we're revisiting a little bit, or not really revisiting, but we're really tweaking a little bit the color coding, that we know that West Virginia is a state that's made up of some very, very low population counties. And when we have very few cases that could happen over a 7-day period of time with a 7-day rolling average that could put a county into the orange, we want to make sure that that's not just a sort of a happenstance, a kind of a outlier event, and want to make sure that that's a consistent, level of community spread. So we will be coming out with additional guidance, and we'll work with the governor and all of our public health people. But we believe this system is good. But for counties that are very low population, this has never been validated. And the problem you have, because you have to do the mathematical adjustment to get to 100,000 population, that in some very small population counties like 5,000, you're using a pretty heavy sort of multiplication effect to get it up to 100,000. And we believe that there's a better way to provide for consistency for those small counties. So not a huge tweak, but a little one that we think is going to make this an even better model.